Continue on the Newsroom Africa, channel 405 with your news feed late night. The third wave of the coronavirus pandemic looming in KwaZulu-Natal. This as government is warning against complacency. Officials warn that failing to adhere to regulations could have devastating consequences. Here to talk to us further, we are joined by the Premier of KwaZulu-Natal, Sihle Zikalala. Premier, good evening and thank you very much for your time tonight on the newsfeed late night. Even though the country continues to see quite low levels of infections and comparatively, and I'm not saying they are low, I mean comparatively to what's happening in other countries, low levels of death as well. Is that low level of infection and death the reason why we are seeing this complacency?
Well, I think it is partly a reason, but COVID-19 taught us one lesson, that it is not predictable. And therefore, we need to be cautious and always protect ourselves. The level of complacence comes from the fact that the numbers are low, and therefore people may think that we've overcome this challenge. It is still with us. The pandemic is still affecting a lot of people, and some are even passing on. And that's why we are saying this level of complacence will not help us. It is important that we are all alert and continue to embrace preventative measures that have been put in place.
Yeah. It is said that commitment to science and public health are what is required in order to prepare us for future shocks. Talk to me about what the province is doing in as far as investment in science, but also in the public health.
Well, public health institutions are being revamped, they are being equipped, they are being also resourced with human personnel that have a capacity to deal with a pandemic and diseases in general. But we are grateful of the work we are doing with University of KwaZulu-Natal, which then talk to science and research going forward, because it is going to be important that we develop mitigating strategies in advance to avert the impact of pandemics going forward. So it is a work that is in progress, and we will continue to do it in all areas.
Now, part of what is happening, Premier, is the fact that there is, of course, a level of comfortability with how things are. And yes, it's a level of comfortability as far as the people are concerned. They are going to pubs, they're going to clubs, they're going to big gatherings and so on and so forth. They're going to indoor gatherings instead of outdoor. But there's also a level of accountability with how things are progressing from for example, law enforcement agencies. Are they still committed, for example, to the curfew? Are they still committed to practices that maintain public order and ensure that there is no breakdown in law and order as far as COVID-19 regulations are concerned?
I would say it is not a question of the lack of commitment. From where we stand, they are committed, but it is a question of ensuring that we, because of number of priorities that are there, they get also stretched and pay attention to what is immediate at that time. And with the lowering of numbers in terms of infection, they might have also tend to become complacent, and therefore we will need to ensure that they are also placed on alert level so that they continue doing their work and enforcing regulations with regard to curfew and other restrictions that are in place.
Yeah. And how do you ensure that we practice that urgency every day on both ends? I mean, that's part of how you deal with complacency, is to practice real urgency, not fake one, of course, not to just scare people when there is nothing, but actually real urgency that is out there currently.
Firstly is to activate our structures and ensure that they are functional and ensure that they are paying attention to the monitoring of the implementation of all regulations that are in place. But secondly, it is to continue encouraging and educating people on their own to embrace the regulations and the protocol, so that they will own up. It should not be that we are only enforcing. People must understand that this is because of their own safety, and they are not doing it just merely to comply with what government wants, but they are doing it to protect themselves, their loved ones, and the society.
Mm. In real terms, what are you doing with the data, for example, that is available? So I read one of the data. Your province contributing 21% of cases that are laboratory confirmed. But not only that, on average, your province ranks 4th highest in terms of fatalities countrywide. So when you compare yourself with what other provinces are doing, what comes up for you?
We are able to analyze the data and be able to cascade the information down to district. But we use the data to intervene, as we are seeing that in the recent weeks, we've seen the increase of numbers in Uchugela, Hirikwala, and King Tsichwayo. It is because once we get the data, we continue to analyze it, check the trends, and then intervene immediately. So that helps us, because it is a guide toward ensuring that there is timeless intervention to deal with all of the issues that are emerging from the ward as well as districts.
Right. You are in one of the provinces that, of course, focuses a lot on leisure and tourism. So people do need to be out. People do need to be enjoying themselves in your province in order for you to get the kind of economy that you would like to see going in that particular province. So what is a win-win solution for you, where you're still keeping the numbers down and people are still able to have that leisure activity and enjoying the tourism product that you have got to offer?
If I may just make an example with this weekend alone, KwaZulu-Natal, especially Durban, was fully occupied with domestic tourists, and we would want to see that continuing. We need to balance that by ensuring that all tourists, including those who are coming from outside the province, when they are here, they follow the protocols that are in place. We continue to engage with the sector, the hospitality industry in particular, to ensure that they also continue to enforce the implementation of the regulations. So that is the approach that we use, which is a win-win situation, because we are not going to afford collapsing the economy and losing jobs, but also we are not going to just say, let's open everything. So we do need to have that careful analysis, balance the situation, and have a situation where people will be able to live. So the win-win situation we are talking about, the balancing act, it's what we are doing.
Are you still happy with the centralization of the vaccine procurement process at national? There are some provinces who are feeling maybe they should procure those vaccines themselves. I know your self-registration system has also gone live. I think it went live on the 16th of April for 60-year-olds.
Yes, it went live on the 16th of April, and it is helping us as we are able to register more people. We are satisfied with the procurement of the vaccine, as it is coordinated nationally. We believe that if we take that mandate to provinces or lower structures, we will not be able to manage the situation correctly in terms of ensuring that there is coherence in terms of the approach, but also there is fair distribution of vaccines that are available. So national so far is leading us in a way that we are satisfied with.
Yeah. Talk to me about that detail that you're raising, the level of coherence. One would say, well, you are closer to the people in the province, and therefore you will know exactly how much you need to procure, and you'll be able to then distribute that equitably amongst the people in your province. You're saying you will have difficulty with that?
Not that we will have a difficulty with that, but the reality is that it is in terms of economies of scale, better to centralize, buy in bulk, and then be able to distribute. Once you leave that to provinces, you will have competition, you will have a lot of challenges that are not of coordination, especially because whatever comes into the country needs to be tested, needs to be proven. And therefore, the centralization is assisting us as the government as a whole.
Premier, I appreciate your time, and thank you very much for joining us tonight here on the Newsfeed Late Night. The Newsfeed Late Night continues for you in a moment.